which will be helpful.
About trying to do it subtly.
All right. Okay, so welcome to the launch of the Nottinghamshire Spatial Planning and Health Framework. I'm Stuart Batchelor from Active Partners Trust, which might be known more locally as Active Derbyshire, Active Notts. And we've been supporting colleagues at the County Council around the development of this framework. I'm just going to pick up a few housekeeping items to start with. We are recording or going to record this session because we have had some requests from people who couldn't be here today to see the session. So it will be sent out, put on a website. Microphones on mute, please, unless you are speaking. Cameras on if possible. I think it's always great if we can see people's faces and see possibly how they're receiving some of the information. It's good to see a no grimace or a good smile. Use the chat or the raised hand function for questions, and we'll try and pick those up and give people a chance to ask them. And we'll try and include a comfort break. If you could put your name and your organisation in the chat, that's always really helpful for people to network during and then outside of the meeting as well. So hopefully I'll be speaking a bit later on and doing some breakout sessions. But in the meantime, I'm going to hand over to Stephen Pointer, who's Planning Policy Manager at Nottinghamshire County Council, and he's going to lead us off today. Thank you.
Yeah, thank you very much, Stuart. Hope you can hear me okay. I'm going to share my screen. So let me just start my presentation. So yeah, I'd like to welcome you all to this workshop event on behalf of both planning and public health at Nottinghamshire County Council. It marks a further milestone in our partnership working across Nottinghamshire to promote planning for health. And including in the workshop is the launch effectively of our updated and revised Spatial Planning for Health framework, which acts to support our work with colleagues across districts and boroughs in the county to embed health into the local planning and planning application process. So thanks very much for joining this event. I know we have people on the call from a range of planning authorities and across the health sector within and beyond Nottinghamshire. Some will have plenty of experience of planning for health, others perhaps less so, but we hope this morning's event will inform, encourage and help to renew our efforts to improve health outcomes through planning. For those less familiar with planning and the planning system, we are in Nottinghamshire a two-tier local government system where our districts and boroughs are the vast majority, carry out the vast majority of planning work and decisions, where the county deals solely with minerals and waste and other county council developments. But the public health function sits with the county, and very recently in Nottinghamshire, our public health function has been brought within our place directorate, where we in planning policy sit. And so why am I involved? My team helps coordinate liaison on planning matters with all districts and boroughs in the county. And part of that role is to work with public health to make sure that our comments and involvement in applications and plans is useful and constructive and effective. So that's planning. For public health, for those who may not be aware, may on the call, counties began the public health role from 2012 onwards. And crucial to this, I know colleagues will come on to discuss further, but is the concept of awareness of building blocks for health and well-being. And it's recognised that many of these building blocks are related to the environment, to people's surroundings, their housing, the kind of travel they use, how they get around. There are a lot of factors that are planning and environment related. And to highlight those links between planning and public health, I'm just quoting Chris Whitty, no less, when he spoke at a TCPA event a few years ago, seeing planning as one of the principal, and he says proper planning, whatever that is, but proper planning has done more for public health than perhaps anything apart from vaccination, which is quite significant. All our planning for health work is done through a joint board, the Nottinghamshire Health and Wellbeing Board, so we're already working in partnership with districts and all the health sector, as colleagues will know. But the journey that we've been on promoting planning for health started over 10 years ago, where we had a framework and a protocol. We've sought to streamline those, bring them together, make them simpler. And we did that in a previous iteration of the planning Spatial for Health framework in 2019. But in 2022 and 23, we carried out an independent review of the framework to see how it was working. And that had some great feedback from our district colleagues saying, DM officers are hard pressed. They need a bit more focus, a bit more bespoke intervention to support their work, validation of health impact assessments, and the fact is that other things have come into being in recent years. Active travel is one example. So, active knots is just part of that, keeping people healthy. And also we've got the new emphasis on biodiversity and green networks. So there's a lot of things that actually are helping now with planning for health. And we've embodied that in our new planning for health, spatial planning for health framework, which Jenny will introduce shortly. But I think I want to just conclude this introduction by saying we're not there yet. This is not about congratulations. This is about preparing for the future. And there are still a lot of health inequalities, not only between genders, but across the geographical area of Nottinghamshire. We've got plenty of areas which are less advantaged and have greater health inequalities, more people dying earlier than elsewhere in the county and so forth. There is a lot of work still to do. So it's even more important we work well together and seek to ensure that planning decisions, which clearly only affect part of the environment, but we want to make sure that planning decisions benefit more than just that development, but can help to transform communities in Nottinghamshire. So I just want to welcome and thank the contributors this morning. Stuart, thanks for emceeing. But we have Gemma from the TCPA, and Carol and Jenny will talk from the public health viewpoint of the county. And welcome to Karen Johnson from Bassett Law, who've recently adopted a new local plan with a lot of good things around health in it. And lastly, David Arnold from the county planning will provide a bit more of a wider perspective on current trends in planning and what is likely to be affecting the planning environment coming up. So hopefully it'll be useful for both planning and health colleagues to come together and share and just develop better relationships moving forward. So thank you for coming, and I'll conclude there and probably hand back to Stuart. Thank you.
Okay, thank you, Stephen. I will quickly hand on to Gemma. So Gemma should be known to a few people on this call, because last year I think it was our second Active Environment Network workshop, which we looked at health and planning, and that really generated a lot of interest. across both counties and to both cities. So Gemma, I'll hand over to yourself and you can take us through this.
Great, thank you very much. Yeah, really happy to be here. Thank you for the invite. And I get the sort of the nice job of just taking a step back from the detail that you're going to sort of dive into a bit later and give you a few sort of broad thoughts on health and planning and how we've got here, and just the important work that this is. So I work for the Town and Country Planning Association. We are a charity with a vision of homes, places and communities in which everyone can thrive. And essentially, we've been kicking around for quite a long time now. And I'm just interested in place. We're interested in places for people. We're interested in places in terms of the built and natural environment. We're interested in the challenges that our places face, be that societal, be that climate change. Many of us will be having a very warm day today, and it's how our place is going to cope with that moving forward. And we seek to influence the planning system. And we seek to sort of pull on our long history of wanting to create healthy and sustainable places that are resilient and fair for everybody. So I'm just sort of starting this by just acknowledging the where we're at, essentially, and just to say that place really matters, and the work that you are all doing that is revolving around place is absolutely crucial, because places shape people's lives. They shape the choices that they can make. They shape their health and well-being. They shape their mental health and well-being. And in terms of planning, well, planning shapes places. So planning is then equally important in terms of thinking about how we make healthy, happy places. My own sort of background and how I arrived here is a bit of a long journey, but essentially I started in public health and have ended up in planning. But I think one of the messages that I would encourage you all to take on board today is that really you're all public health practitioners. You're all at the forefront of actually what makes and keeps people healthy, and that's really important. And we start at a moment where we face challenges, and I hate to be deficit led, but we'll start here and then we'll get better. But yeah, we do face challenges. We're still in that post-COVID recovery that sort of knocked us back in various ways and changed how things are working. We are facing health inequalities. We are facing inequalities in how long people live, but then also actually how many years they live in good health, which is also something that needs to be tackled. As mentioned, it's the climate pressures, it's how well our children, young people are doing. And then we're facing a new government, yet more planning reform for those of you that are planners on the call, and obviously challenges to local authority resourcing and devolution and all the rest of it. So it's a challenging context, and it's good just to recognise that up front. But there are also then lots of opportunities in that, because it is a moment of change. The government missions around health and growth give us a bit of a narrative that we can latch on to, and they've also stated that they want the healthiest generation of children in history. Well, that's something we can also latch on to. 1.5 million homes, so new homes, new whole places, the opportunities to get really good planning into those, proper planning, as the Chief Medical Officer might say. And also just recognising actually that you're all here, that passion and commitment from everybody to work together across the system, so across the local authority, across the sort of third sector to get this right, and with government as well. So driving innovation and calling for change. So before we sort of look forward, we're just going to take a quick moment to look backwards. And when I go backwards, I mean really backwards. So the evolution of planning and public health, they sort of arrived together. To be fair, public health just about wins. So public health legislation came just before the first planning legislation came in. But essentially, the two have been working to shape place and to look at how you help people live healthy lives, initially focused on sort of more environmental factors, but really concerned with over time, how do we create healthy places? There are some very notable characters in that long history. A little bit too often we focus on usually the white men with varying amounts of facial hair, but there are lots of women who were involved in these movements and who did amazing and influential work. But essentially it's this same root. So public health and planning grew from this same root, this concern for people in place. So it was sort of back in the Industrial Revolution, where mass urbanisation and mechanisation was just leading to really poor societal, environmental and health outcomes for people. And these were very much manifesting in the towns and cities where that was occurring. And there was lots of poor health associated with that, with the overcrowding, with the unsanitary conditions, etc. So the Public Health Act, which came in 1848, was a recognition that we had demonstrated, the evidence demonstrated, that you could modify the environment and change the disease burden that was occurring for people. And so that public health legislation was the precursor to the planning legislation that would come after. And it was, initially directed at the adequate sort of sanitary conditions and the prevention of acute infectious diseases, and has been extremely successful, right? We're not having those conversations anymore. We sort of have done those bits, but now we're moving on to modern challenges and how we respond to those. From our own history as an organisation, we were founded by Ebenezer Howard back in 1899, who went on to found the first garden city in 1903, which is Letchworth. And essentially what he was thinking about was, well, how do we take the best bits of the cities and towns? How do we marry that with the best bits of the countryside and create places that people are happy and thriving in? And that was not just about the physical infrastructure. It was about social justice. It was about beauty and economic efficiency and access to nature and all of those things. And once we'd had the garden cities, after the war, we moved on to the New Towns programme as well. So that sort of post-war era of housing reform and building out huge amounts of homes. Homes fit for heroes was the sort of tagline at the time. But really that planned environments and how we could create those. And that obviously coincided with the creation of the NHS as well. But what we sometimes lose in that story is that the NHS was created not to sort of take over, not to go it alone and be the only service interested in health. Planning was always supposed to be there in the mix in terms of a tool for prevention, a tool for keeping people healthy in the first place. And so that's what we're sort of moving on, what it was originally designed to do, but we sort of managed to drift apart a bit. So essentially planning and not proper planning has led us to a situation where we've had sort of maybe the rise of more market-led activity, deregulation, and a loss of that social purpose in terms of planning. And you get really then problems big and small in terms of that. So you can see on what hopefully is your left-hand side, where you get deregulation or lighter touch regulation. So homes that are created out of existing office buildings through a system called permitted development rights. They are often really poorly done, and they are often in very much cut off, isolated places. So you can sort of see the red circle highlights where that building is in the middle of a sort of light industrial space. So if you're a child growing up, you've got no access to any sort of green infrastructure, parks, you can't play outside, you're surrounded by the noise and the traffic from that industrial estate, and your ability to sort of walk anywhere easily to the shops or to school is completely cut off. And then, as we've already mentioned, we're focused on the fact that we are facing climate change. We need to be building resilient places. And we've also had a real challenge around the explosion of cars and the car dominance of our places that we are building. So there's sort of the consideration of health has perhaps in places become weak in terms of planning and what we're building. And if you're interested in lots of that stuff, then I would encourage you to look at our website and some of our campaigns around that. Especially we're about to launch a new campaign around the homes and the permitted development rights part in the next week, I believe. And just to touch on this as well, in terms of that car dominance, you can also see how that has affected our children and our young people in terms of their ability to be outside and to roam. Cars is not the only thing that has caused this. Our society has sort of shifted. We've become more risk averse, and we, yeah, there are other issues around this. But essentially, you can see from both of these diagrams, and this is not just a UK issue, that you know, in generations before, this is based on a typical 8-year-old. You know, the great grandfather was allowed to walk 6 miles from home to go fishing, whereas the son, you know, 3 generations later, at most is allowed to walk 300 meters to the end of their street. And if you look at the Bratislava sort of way of mapping the same information, actually they're not even allowed out onto the street. It's only allowed in the enclosed, the child is only allowed in the enclosed yard, sort of under that parental supervision. It's quite an interesting little exercise. I would encourage you, if you have a few minutes later, just to reflect on your own childhoods and how far you were allowed to go and at what sort of ages, because it, you know, I've sort of done it for myself on my own children, and I do recognise that it has shrunk, and there are lots of reasons for that. But it's definitely a problem, and it's something that we need to be thinking about if we want our children to be growing up to be active and healthy, and also have that chance to sort of develop the resilience and independence that they need to transition to adulthood. So it's a big issue, and one that we are continuing to work on in terms of how we support places to create more child-friendly environments that include covering issues like this. So let's get a bit more positive. So we have sort of seen change. We have seen increasing activity to reunite health and planning, and to re-articulate what we know makes for healthier and more active places. You know, we're not facing the same challenges that we were back in the 1800s, so we do need to face our sort of modern challenges, and we need to name those. But essentially that's happened over the last 10 plus years, and a big part of that is actually due to public health returning actually into the local authority areas and out of the NHS, and that has driven that conversation. So there are lots of things that we could look at, including the document which is called Spatial Planning for Health, which came out in 2017, which was a Public Health England document that sought to sort of summarise the good practice and what we know. The learning from the NHS Healthy New Towns programme is still relevant, and particularly relevant when we start to think about this new generation of new towns that the government is talking about. And then there are things like Building for a Healthy Life. There are plenty of documents like the one that we've written in terms of how do we support local authorities and local planning authorities to re-embed health into local planning policy through local plans. And we did that with the Trude Research Consortium, who have worked for quite a long time on the evidence. And then there's lots of guidance in terms of how local authorities can tackle sort of different elements of this. So I've just highlighted the Healthy Streets model, which I'm sure lots of you will be aware of, but if you aren't, really worth a look, where you actually sort of think about a street from a person-centric point of view, and what does it need to do, and how do we make our streets healthier. And then also it would be remiss of me not to highlight Sport England's active design principles. And when you look at all the guidance, you'll see lots of circular diagrams. We do love a circular diagram when we start to think about these things, but I think some of that comes back to this fact that it's not just one thing anymore. Like, we all know that we need this sort of whole systems approach. We need to be thinking in the round about these issues and the challenges, because they're not simple to solve, and each bit of the local authority needs to take its sort of role seriously in terms of health and getting that right. So we end up with lots of circles, but that's not a bad thing. So we're, you know, it's about supporting places to make health a consideration, and from a planning point of view, make health a consideration in planning policy, but then also in planning decisions. And they are two slightly different things. And that's where having the support of a framework like this and a team who are committed to planning from a public health perspective is really important. So thinking about that system thinking approach. So we have this opportunity, and this is something that the county is obviously taking seriously. There is the national hook in what is called the National Planning Policy Framework. It's a shame it takes until paragraph 96 to get the first decent mention of health into it, but it is there and we can use it. But healthy placemaking and healthy planning should be a core principle of all local policy. Many authorities will take a health in all policies approach. They'll recognise that the wider determinants of health are impacted across many different settings. And there is also a role for getting serious about health impact assessment, which I know is something else that the framework starts to really put some detail behind. It's not new, but we do need to make it normal. We need to make it like this, the approach that happens. And it's really encouraging to see the framework from Nottinghamshire, setting out so clearly how it can work and how you can work together to drive forward this change across the county. Appreciate the challenges, but it is really important. And what's going to come up again and again, and already has, and I think Carol is going to pick up on this next, is just how important this is. Because what makes and keeps us healthy is so many different things, and we need to tackle all of those things in all the places that we can. So I often use the phrase everything, everywhere, all at once, stolen from the film. But essentially, that's the approach we need to take. We need to take and seize every opportunity because it's really important. It's important for the individual. It's important for their family unit. It's important for communities. It's important for whole areas, be that a local authority area. But it's also important for us as a society. The challenges we face are responsive if we can get some of this stuff right, if we can do better. And so there is huge opportunity to do that. So we look forward to sort of hearing some more detail on the framework, and thank you for having me this morning.
Great, thank you, Gemma. As always, absolutely spot on time, because you've given me a 2-minute bit of a segue, I think, because you've mentioned children's play. I'm aware that there's some legislation hopefully going through Parliament around children's play that's being pushed by Play England. And we have, this is where I'll do a little bit of an advert, if that's all right, Jenny. We've got an active environment workshop on the 16th of July, which is the importance of children's play, and Play England are facilitating that session. So from a planning policy point of view, that'll be really worth joining, because it will give the latest information on what hopefully will come through from a requirement in a planning point of view. And if there's nothing more important than that first start for children and the importance of play in their lives, to give them the opportunity to fulfill, a successful life, then play is so important on that. So thank you for giving me that segue into that. So I'm going to hand over now to Carol Ford. Carol and myself met in Derbyshire Public Health Days, and Carol did some great work in Erewash, where I think a lot of this kind of agenda is moving forward. And now you're at Nottinghamshire County Council, Carol, and you can tell us all about the building blocks of health that you've been championing.
Thank you, Stuart. Can you see me and hear me? My Teams has been a little bit odd this morning.
We can see your presentation.
Oh, can you not see me?
No, you seem to be a white square with a blue.
Oh, that's a shame. So, well, apologies for that. My Teams has been a little bit odd, but I don't want to log out and log back in case it doesn't work at all. So I'll stick with it and just give me a shout if anything gets stuck. So thanks, Stuart, and thanks, Gemma. I really enjoyed that historical context. I love that story. Thanks for inviting me. So for those I've not met, my name's Carol Ford. I'm a senior public health manager at the County Council. I've currently got the lead on the building blocks, kind of work programme, what we might have described as previously as wider determinants. Can you just let me know if the slide has moved on for you?
Yeah, it has now.
Yeah, okay, right, I think we're good. Okay, so I think I've got like 15 minutes, so I'll probably talk for about 10-15 minutes. I'm going to share an overview of the building blocks of health for Nottinghamshire. We'll look at some of what those gaps look like, how some of those inequalities are experienced, and then finish on some thoughts around how much of an opportunity this is to be addressing those gaps. So I'll just start with, this is a visual you might have seen a number of times. So we all know that what surrounds us shapes our health. We've been talking about the wider determinants or social determinants of health for a long time now, and the associated health inequalities. So this visual, just a reminder from the Health Foundation that as little as 10% of population health and wellbeing is linked to access to healthcare. And I think it's always worth having that reminder. There is so much more going on around us that we know can have a really significant and lifelong impact on our prospects for good health and wellbeing. But how well is that really understood? And how can we communicate about these important factors impacting our health and wellbeing in ways which increase understanding and drive action? So cue the building blocks of health. I'm sure people will have seen this in Nottinghamshire now. So this is this narrative is from the Building Blocks of Health Communications approach, which is from an organisation called Frameworks UK, who worked with the Health Foundation. And it's an evidence-based approach to framing our communications on these important issues. And it provides a series of recommendations for the most helpful ways to talk about these issues in ways that drive action, address inequalities, but also help us to shift some of the conversations around health from individual behaviours and choice, which can be linked to stigma and blame, to broader conversations around these wider factors. So one of the key recommendations is the use of this metaphor. So our health is a precious asset. Good health and well-being enable us to live healthy, fulfilling lives, free us up to achieve our potential. And to create a society where everybody thrives, we need all of the right building blocks in place. Stable jobs, good pay, quality housing, education, transport, connections with family and friends. But we don't all have the same opportunities to live healthy lives. And right now, in too many of our communities, blocks are missing. When we don't have what we need to heat our homes, buy healthy food, for example, or we're constantly worrying about making ends meet, it can lead to chronic stress, poor health, and ultimately lives being cut short. It is time to fix the gaps. So in Nottinghamshire, we've done a lot of work recently. We've published a number of joint strategic needs assessments to help us understand what these blocks look like in Nottinghamshire, what the gaps look like, what the solutions might be. And that's kind of driving and developing a programme of work, which all sits underneath the Nottinghamshire Health and Wellbeing Strategy ambition to create healthy and sustainable places. And I'll now just kind of spotlight a few of those areas. So if we look at food, for example, the wide-ranging long-term health and wellbeing impacts of not having access to healthy, nutritious, affordable food. And if we just think through one example, if a young child is experiencing food insecurity, they could be tired and hungry at school or nursery. This can impact their development. It can lead to poorer educational attainment and consequently poorer employment prospects. So lifelong impacts, and that's just thinking through one potential impact of food insecurity. And just a little fact there from the JSNO we published last year that in June 2023, it was estimated that 110,000 households in Nottinghamshire were experiencing some kind of food insecurity. And for a bit of national context, it's 1 in 4 households with children that will have experienced food insecurity. So it's a big issue. If we move on to housing, affordable, warm, safe housing, it's a cornerstone of good health, and experiencing fuel poverty can have a range of serious impacts, and that includes things like risk of respiratory conditions, increased risk of hospital admissions. And this fact, again, is from the JSNO that we published last year around fuel poverty, where an estimated 13.9% of households in Nottinghamshire were living in fuel poverty. And that broadly means households that can't meet their energy needs at a reasonable cost. So meeting your energy needs brings you below the poverty line. Okay. And if we move on to kind of connections with family, friends, communities, so the nature of our social networks, the quality of our relationships, the support we have, if we feel that we belong, and loneliness can all influence our health and well-being in a range of ways. And loneliness is associated with a number of poor physical and mental health outcomes. And just a fact there, which is from our Nottinghamshire Community Centred Approaches JSNA, again published last year, that in Nottinghamshire, research suggests that 23% of adults reported feeling lonely, always, often, or sometimes. And then lastly, a little bit of a spotlight on good work. So being in good work benefits our physical and mental health, and those who are unemployed are 5 times more likely to have poorer health. There's loads of links between good work and physical health and mental health. In Nottinghamshire, I think this is from 2023, the economic inactivity rate was over 22% in 2023. So that's 1 in 5 people not in work or not seeking work. I'm just going to look at food in a little bit more detail, just to show the gap that we've highlighted there. It's not experienced equally. We've talked about inequalities already geographically and for different population groups. And this again is from the JSNA that we published last year. On the left-hand side there, we've highlighted a number of groups that are at higher risk of food insecurity. So they are those on a low income, those who are unemployed, households with dependent children, people living with disabilities, minority ethnic households, and people between the ages of 16 and 34. When we published this JSNA, we also published the fuel poverty JSNA at the same time, and I don't think we'd be surprised to see that the list, when we look at groups at high risk of fuel poverty, is very similar. So you start to see a compounding impact of these inequalities. And then on the right-hand side, just to illustrate just how the stark difference that you might see in different geographical areas. So this is a measure of food insecurity. So those bars on the right, they're a percentage of local authority population living in areas at highest risk of food insecurity. So just to highlight the difference there, so for Mansfield, for example, that's 54.5% of the population living in areas at highest risk of food insecurity, and that compares with 5.8% for Gedling, for example. So just to illustrate how different some of these gaps can look. I'm going to confess that I've borrowed this slide directly from the Health Foundation, so thank you. So to more specifically about our surroundings. So as we've already explored, where we live shapes our health, including how long we can expect to live, and those inequalities between different areas can restrict people's opportunities to live a healthy life. Now, for good health, neighbourhoods need clean air, and there are some kind of national inequalities around that to highlight. So people from a Black British, Caribbean or African background are 5 times more likely to live in the most polluted areas compared to white people. For good health, a neighbourhood needs to feel safe. Again, a national figure for you. So people aged 16 to 24 are twice as likely to live in areas with the highest crime rates compared to people aged over 64. And then lastly, for good health, a neighbourhood needs fewer unhealthy retail outlets. And one example is that people who live closest to a tobacco shop live 2.9 years less than people who live furthest away. And there would have been many other examples we could have drawn on there to illustrate those inequalities. Okay, thank you. Okay, my slides got a bit stuck there. Can you just let me know if that's moved on to the opportunity slide?
Yeah, it has.
Lovely, thank you. So I just wanted to finish with some thoughts around the opportunity that we've got here. So when we talk about the building blocks of health and we use that communications approach, one of the 5 recommendations is to move to solutions quickly. And this is an easy one to move to a conversation about solutions, because this is a huge solution for us. And when we talk about the wider determinants, I don't think there are many solutions or tools for us that can impact so many of the different building blocks. So from kind of my perspective leading this programme of work, this is an intervention that's wide-ranging, it's systematic, and it's got the opportunity to impact health and well-being of communities for generations. So it's a huge, wide-ranging opportunity if we can embed it and it can become business as usual. There's a huge opportunity for us on our programme of work. And secondly, I just wanted to consider as well that we're learning here, aren't we? This is not the first version of this tool. As Steve described earlier, this is developed over a number of years and it will continue to develop, and we've got some real strong partnership to build on. And I'm just keen that we kind of learn together and grow this and learn as we go along. And whether or not today there's some opportunity to think about regional opportunities, this is an excellent opportunity for Nottinghamshire to develop this tool. But there are there opportunities for us to kind of shout a bit wider about this and try and influence those regional discussions as well. So that's it from me. Thank you. Hope that was helpful.
Great, thank you, Carol. That was excellent. And again, you're ahead of schedule, so I'm in a unique position of having to fill time rather than save time. I think the whole building blocks piece of work, it's really helping people understand. I think it explains things better than wide determinants of health, and there's some real traction in it as a concept being used, and that was very helpful to understand that. I also think, not so much for today, but certainly for future events, we're kind of focusing around creating a movement from the doorstep, and the biggest barriers to that we've found from listening to the community is safety. People feeling safe leaving their doorstep, whether that's road traffic safety or it's safety from antisocial behaviour, etc. Then infrastructure, which is all about the paths, the benches, how important a bench is for people who go out walking, and then that opportunity and having the opportunities to go and walk or cycle or wheel from the house, and some of that needs to be supported, but that's where I suppose the behaviour change aspect comes in, that's so important. So thank you very much for that. That's very relevant to today and the future. So I'm going to hand over now to Jenny Charles and Nina Wilson, who have been the driving force behind this framework. They've, over the last 18 months, kept everybody going on this and pulling it together. So Jenny is from public health and Nina is from planning policy. And I think in terms of having that close working relationship between those two parts of the council is really, really beneficial and allowed this to move forward. So I will hand over to you, Jenny.
Okay, I will just share my screen, so bear with me. Is that coming up? Yeah. From the beginning.
Yep, that's fine.
Is that fine? Is that
but
showing?
It's showing your last slide, so that was really quick, Jenny. So if you go back to the start.
Here we go. Can you see that now? I'm going to.
Yes, that's great.
Okay. So I'd just like to introduce myself again. So I'm Jenny Charles from Public Health. Unfortunately, Nina cannot be with us today, but in her absence, I would like to just acknowledge the support I've had from other planning policy colleagues, and that is Will Lawrence, Charlotte Copley, and from my public health colleague, Nimisha Patel. Okay. If I just move on. So often what's been highlighted by previous speakers from Gemma and Carol, it highlights the need for public health to play that supportive role within our local planning authorities. But I'm often asked by close family and friends, well, what is spatial planning and health? And I've kind of picked on this actual pictorial sort of version, and what it constitutes for me is that a healthy neighbourhood has a sense of wonder in terms of, you know, distinct designs, areas for culture, play and recreation, also a sense of wonder in the sense that we can actually enjoy the space that surrounds us, which has been really emphasised by both Gemma and Carol. And getting around is often very, very important in terms of what Stuart's just mentioned, in terms of walking, wheeling and cycling, and the ability to access public transport. And that connectability within our communities, that sense of belonging and that neighbourhood and jobs and local services, and other things like connection to nature, health equity and housing standards, and air, noise and light, and primarily access to healthy food choices. And for me, this wraps around the ethos of what spatial planning and health is about. So I'll move on. So what the spatial planning and health, what's been emphasised is a systematic approach to integrating health and planning and ensuring that health considerations are consistently addressed in planning decisions and processes. Now, what's been highlighted is the rapid health impact assessment tool, and this has the potential for developing a significant impact by providing a structured framework for incorporating health and planning processes. And as Carol and Gemma have alluded to, what surrounds us really shapes us in terms of the building blocks, and spatial planning and health framework is the enabler which planned developments and policies through these building block lens can actually shape and constitute these elements that support a healthy neighbourhood. Okay. We're just moving on. Okay, so the framework changes, and what I've highlighted here, which you probably just had a brief look at in my clumsiness to actually start my presentation, we have a new website that has been created to add some additional resources to showcase some of our local plans and some national policies, local initiatives that impact on health and planning. Now, the Rapid Health Impact Assessment is the centre point of the spatial planning and health framework. And with the support from the website, it shows links to our local plans. It also has a template that shows case study examples showcasing how to complete a rapid health impact assessment and highlighting some best practices across our sort of local planning authority partners. There's an email link to encourage that communication and collaboration between our colleagues internally and externally to help deliver those healthy places. Okay, so the Rapid Health Impact Assessment consists of the 12 indicators, and these are closely linked to those building blocks of health, which Carol actually shared in her presentation. And it helps to identify and mitigate any potential effects, again, of any proposed development or policy or that might impact on a surrounding community. By incorporating the health impact assessment, the Nottinghamshire Rapid Health Impact Assessment into the planning processes ensures that systematic health and wellbeing evaluation that enables assessments of various areas that include those housing qualities, healthcare access, green spaces and noise quality, transportation options, and crime prevention, and the availability of healthy food, and those job and education opportunities, and essentially that social unity. And it is also a resource for highlighting those climate factors and those issues with health inequalities. So the benefits of actually undertaking the rapid health impact assessments, it helps to promote that public engagement and participation amongst our communities and our partners to enhance those positive outcomes for promoting physical activity and access to good healthy food. So as part of the changes to our rapid health impact assessment, there has been some detailed descriptions and evidence added to it. So the criteria descriptions are more fuller, and they include, which should help provide a bit of clarity and a better understanding to our partners. As I said, there's evidence and resources that are linked to some local initiatives and some national policy that is also included in the rapid health impact assessment. Also, we've also put some additional good practice, which is the addition of a question for consideration about the digital connectivity to reflect good practice across our local planning authorities and ensure that the digital infrastructure is considered as part of the planning decisions. So the Nottinghamshire Spatial Planning wraps round all of these aspects, and the website acts as an additional resource which can be accessible to all. So just to give you a few examples of the criteria, of the changes to the criteria indicators in terms of description. So this criteria indicator talks about housing quality and design, and you can see that there's a fuller description which was not previously present in previous rapid health impact assessments that we had with the other policy frameworks. The resources are highlighted as well in terms of details and evidence, and as you can see, it highlights the National Design Guide and the impact of housing quality and design on all age groups. A further example is criteria 2. I've just picked out a few examples, is access to healthcare services and other social infrastructures. So again, there's a fuller description that includes wider things beyond health in terms of culture, services, and we've heard really clear references from previous presenters, Gemma and Carol, about the value, and Stephen, for the value of our joint strategic needs assessment and that community-centred approach to health and wellbeing, which was highlighted by Carol in her presentation. So there is a fuller description, just to reaffirm, and more detailed evidence that accompany our rapid health impact assessment. And finally, just for another example, just to highlight criteria 3, which is access, indicator 3, which is access to open spaces and nature. And this is just highlighting connectability and accessibility. And again, drawing evidence from across our local landscape and just highlighting Sports England and active design, amongst others. I've only taken a snapshot of some of the evidence that supports this particular criteria. Okay, so when should we use a rapid impact assessment? As shown above, the rapid health impact assessment is available for assessing either development proposals or planning policy documents. And the challenge is sometimes it's not always appropriate for all types, but the framework has done their best to just explain where it is appropriate and who actually should undertake the rapid health impact assessment, from a strategic planning application to a new local plan or a local plan review. Okay. I'll just move on. So there is the spatial planning and health framework through the rapid health impact assessment has also set out requirements where an application should be proposed for the completion of the HIA. So it pinpoints residential developments of over 50 dwellings, also non-residential developments of over 1,000 square metres or more, and other developments that are likely to have a significant impact on health and well-being. And the developments that meet the thresholds completing the RHIA, the Rapid Health Impact Assessment, as prescribed by the relevant local planning policies amongst our local planning authorities. So the next steps in this timeline, and I want to probably draw back to what Carol has said, really, is to continue and strengthen that engagement and opportunity to connect through our partnerships across health, planning systems and other networks to raise the awareness and to apply that healthy, sustainable developments and policy approach. And that's where I will finish, because you've already seen this slide, and just say thank you. And as I said, the new website has been created as an additional resource to showcase local plans and national policy that support and impact on health and planning. And the link is actually embedded in this slide, which we will share with you later. So I want to sort of thank you for your attention and head back to Stuart. So I'm just going to end my show.
Great, thank you very much, Jenny. Another very timely presentation. So that's great. I guess, you know, this will be kind of new to people, and we're working out, well, how do we apply that into our work, etc. In terms of the breakout rooms, we are going to be asking people about what help they need to kind of implement this framework into their work, and what perhaps we can improve, what training needs, etc. So if you think about that over the next half an hour before we do the breakout groups, that will be really useful, because what we don't want this framework is to be a strategy or a policy that's on the shelf. We want it to be weaved into the work that everybody's doing. But absolutely appreciating that planners are under a whole range of pressures, capacity being the biggest thing really, and having the time. So how can we support people to be able to make the most of this toolkit? So we've had the context setting around health and planning. We've now understand a bit more about the framework. What's really great is now we can hear about some good practice that's happening in Nottinghamshire. And when Gemma Hyde and myself were planning the workshop we did last year, Gemma came up with an example of good practice, which was in Bassetlaw, which was so great to hear that we had some good practice that was there. And Karen Johnson, who's now going to talk to us about that good practice, did a really good presentation at that event. So I've got complete confidence in her now being able to really help us understand what this looks like in practice. So Karen is the Planning Policy and Specialist Manager, which is sounds a very interesting job title, I believe. I'll hand over to you, Karen.
Thanks, Stuart, and no pressure there then for this one. I shall just share my screen if that's okay.
Yeah, we can see that. It just needs to go on presentation mode. Yeah.
Yeah. Lovely, thank you. Yeah, so good morning, everybody, and thanks for having me. Yeah, as Stuart said, yeah, I've got quite a long job title, Planning Policy and Specialist Services Manager. What that means really is the team covers local plans, neighbourhood plans, and natural environment as well. So all of them, as all of the previous speakers have said, really play a vital role in delivering positive planning and coordinating that with health as well. So I think my team are sort of ideally placed to kind of deliver positive health outcomes in the district, but it's important to do that we've got the right tools to work with. So probably to start, as everybody seems to have done, with the kind of the negative slide, and then hopefully we can pick the pace up and move into the positives. Bassetlaw is one of those areas that does have a lot of significant health inequalities. Just a few of them are kind of highlighted on the screen there for you. I think the one that always stands out to me is the difference in life expectancy depending on where you live, which can be close. It's like 10 years in some cases, and that can just be depending on which side of a town that you live on. And that's quite a stark statistic that I think planning should be able to improve on. And hopefully the local plan and the tools that we've got through health impact assessments and design frameworks can help us move in the right direction. And I think I'm picking up on what Gemma and Jenny and Carol have all said. We've also got a sort of a more recent statistic, which is around our young children and young people, and both of those statistics are above the Nottinghamshire average. So that's obviously a key area for the council. It's in terms of encouraging children to be a little bit more active, but providing them with that safe space in which to do it as well, and making sure that parents and carers are comfortable with the way that those spaces are set up and used. So this was a challenge when we were looking at the local plan. It was obviously a very key issue, and it was one that we needed the local plan to manage positively. I've got to say we were probably starting from a very low baseline because the core strategy, which was the previous plan, lacked a lot of detail around health. It was of its time, and it didn't really address health in the way that we would have liked it to have done. So it was really important for the council that the local plan made that positive response to quite key local issues. So the previous health framework kind of arrived in a very timely manner around about that time when we were looking at this, and we really needed something to be able to start the conversation internally, and having a framework that gives that, it's very structured, but it's well recognised as well. The format and the questions are very well recognised across the country. It's a tried and tested approach, and it was a really sound basis for us to base our policy approach on. So fast forward, I won't take you through the ups and downs of the local plan, but fast forward to recent times. Yeah, as Steve mentioned earlier on, we have an adopted local plan now, thank goodness. But healthy placemaking is quite essential to it. So as a result of us being able to build on the work that had gone into the previous framework and the health impact assessment, we were able to kind of raise the profile of health in the local plan. It has its own section in our local plan, but also, like everybody said, it's that whole systems approach. So it's not just about boxing it off as open space provision or health impact assessment. We do recognise that there is that sort of golden thread that runs through the local plan where health is very cross-cutting and it deals with so many different issues. We'd also done a lot of work on what we were hoping would be a new settlement, but for lots of reasons I won't bore you with today, that didn't kind of progress. About healthy placemaking, the Town and Country Planning Association and Sport England were involved in those discussions. And at that time, it was about making a healthy new settlement. But when we took that back to the office, the view of the team was actually those principles should apply to all new development, particularly some of our bigger sites. So we have a couple of urban extensions in the district, and actually the principles of the TCPA and Sport England absolutely should translate into developments of that scale. So they are kind of given a bit of a shout out in the local plan as well, that we kind of highlight those as good practice, which very much reflects the approach that Jenny's just given around having that really sound evidence base to promote to developers. So we're reassuring them that actually this is something that they can do and it's very easy for them to do, which sometimes developers do need that little gentle encouragement. So we manage all of this through an overarching healthy active lifestyles policy. And the key thing that came out of that was the requirement for health impact assessment. So for many of you on the call, this may be something that you already do. For Bassett Law, this was a whole new, it was the first time, it was the first time we'd ever introduced something like this. It's given particularly our politicians something to really latch onto and to shout about. And they see that as a very positive step in trying to manage health inequalities in the district. So it has by default just raised the profile of planning and health in the district, and hopefully our developers are picking up on that now. So at this point, it would be fantastic if I could show you some really good examples of where we've used the health impact assessment in Bassett Law and it's had that positive outcome. Unfortunately, all of our site allocations are still in that consideration stage where they're with our development management team at the moment. So I can't show you the before and afters. Maybe next year we could do something on that. But what we have done in the meantime is, rather than just kind of leaving that as our end point, we've taken the local plan and used it as a bit of a springboard for other projects that we want to do in planning and then across the council. So one of the things that will be coming, heading everybody's way soon, is a new design code for the district, fairly soon, so watch this space. And what we've done is we've taken the principles from the HIA and we've asked our consultants to kind of embed them in the design code. So we've now got the health principles very firmly reflected in our new design code approach. So there's no kind of section that says to a developer, this is what healthy placemaking looks like. Rather, all of the design code reflects all of the key issues and questions that come up in the health impact assessment. So basically what we're asking developers to do is we're asking them to maximise the positive impacts at that local level, so recognising what the issues may be in that locality of their development, but also to minimise the negative impacts that their development can have on health. And we're starting to build up a package of tools to make their life a lot easier, so they can't basically to reduce the risk of challenge. So if we've got a design code, they know what's expected, they've got the health impact assessment, they also know what's expected from the health side. So we're starting to give them a really good toolkit to work from in the future. And then in terms of other first times, that using the HIA also kind of led us to be able to develop a whole range of other policies, excuse me, that can benefit health in the district. So for the first time, we have got more detailed open space standards in our local plan, which kind of focus on not just on the amount of open space, but on actually quality and accessibility, which, you know, comes back to Gemma's point around how easy it is to actually use open space and how far are you comfortable letting children travel to be active in today's world. We've also been able to be quite specific with some of our site allocations around walking and cycling connections. Going back to Stuart's point about active travel, we've been able to sort of raise the profile of active travel in the district. We'd probably like to have done a little bit more, but you know, everything's a step in time. I think we need to take the wins and then build on that as we move forward. But certainly for some of our employment sites, we have seen a pattern in some parts of the district where cycling in particular is a key mode of transport for people to get to work. And so because of that evidence, and then because of the way the HIA was leading us, we were able to ask for a very sort of significant walking and cycling connection to the biggest employment site in the district. And our developers are working with us on that. So we haven't seen any challenges on that one so far. And then finally, and hopefully for some of the NHS colleagues on the call, it will be a positive, is that probably for the first time, we've been able to secure developer contributions for improvements to GP surgeries. And again, that comes out of the health impact assessment, where we're asking developers to think about, are they mitigating their impacts on health infrastructure? And we've also been able to set aside some strategic SIL monies for improvements to Bassett Law Hospital as well, which plays a vital role in managing the needs of all of our residents. So I think not only did we manage to get the health impact assessment in the local plan and have it used very positively by our developers, it then did lead on to a number of other conversations that more widely will benefit our communities, and hopefully starts other conversations that should we ever go to local plan review, we can then start to build on the baseline that we've got. It's giving us that really strong baseline for the future. I might be a little early, Stuart. I don't know whether you're going to have to do a bit of filling.
Well, I think possibly people can just reflect on that, and for those that haven't been blown away with that presentation, just think about how joined up that whole piece of work is, and that whole system approach to it, and it's a really great example of what can be done in an area, and so that's really really helpful. Thank you, Karen. I'll probably just touch on there's a few other pieces of work that are happening around this agenda across our patch, which we're hoping to bring forward in workshops or a conference later. One is the concept of net movement gain. So in the way that net biodiversity gain is is accepted within planning and used. Then in Derby City, they've written into their corporate plan, and which is great, it's written in, but at the moment it doesn't mean anything. So their urban designer is doing some work around what net movement gain means. So how can the physical activity on the movement aspect be considered within new developments, and there be an added value from it. But also the council want to look at how that works on anything that's done, whether it's a park redevelopment or an urban space regeneration of doing that. So we're hoping to bring forward some of that learning. And there is a colleague on this call today, Dave Stock, who's doing some work as a consultant with Amber Valley about building in movement into their green space strategies and hopefully their local plan. So again, that's a piece of work that hopefully we'll be able to disseminate going forward. But I think it's really exciting that all this is happening, and I think our role is to try and bring a bit of capacity to help local authorities, local planning authorities to have some thinking space, and not just be hit with another requirement, but actually how do we support that? So thank you very much, Karen. That's great. I'm going to come over to another person who left Derbyshire to go over to Nottinghamshire, and we had some brilliant work going on in Derbyshire around health and planning, and we've then we had a conference, an active design conference, a couple of weeks before lockdown, which I'm not sure was a super spreader event for COVID, David, but since then we perhaps lost a bit of momentum on that, but certainly you've come into Nottinghamshire and have picked that up. So I'll hand over to yourself as head of, let me get this right, head of planning and environment, which I think is a great merger of that kind of outdoor environment piece, service area and planning. And you're just going to talk to us about some of the opportunities and challenges going forward.
Brilliant. Thank you very much, Stuart, and good morning, everyone. So I do have some slides, which I'll just get up now. So I'm just...
we can see that.
Yeah, brilliant. Just bear with me. Okay, is that okay now?
Yeah.
Yes, so thank you, Stuart. Yes, I'm David Arnold, Head of Planning Environment at Nottinghamshire County Council, and we have responsibility in really helping make Nottinghamshire a more sustainable place, whether it's promoting sustainable travel, managing green spaces, or through our role as a county planning authority, considering important developments like new schools or new transport routes. So we also help secure developer contributions for our key infrastructure to help support sustainable development. I would just like to say, colleagues have done an excellent job in taking forward the Nottinghamshire Spatial Planning Framework, which is a really good tool in really starting a conversation around how we can plan for healthy places, and also raising awareness of the links between planning and health. So it really is good. So thank you for that. So there's a lot to cover in 15 minutes. So I think I'll just start off by looking at the challenges in finding the balance in planning for sustainable development, particularly around delivering social objectives. And then I'd like to just give a brief overview of the proposed planning reform, and we'll pick out a couple of changes that are relevant here, and then using that, look at some opportunities and challenges, and then some concluding remarks. So, like everyone, I just wanted to start off with a few headlines. So it's a very quick overview. This is taken from Nottinghamshire's council plan, and at first glance, the main portrait headlines paint a very good picture. But as we know, when you start to drill down, it's very clear that there are lots of differences and variations in our places, which begin to emerge, and we've seen that through the presentations. So at Nottinghamshire, we have an observatory, and that really does pull all the data together at a very much lower level, at all sorts of lower output levels. And I think it's this data where you'll see pockets of the differences and trends within the county. So I think that's the very first challenge. So what we do is all about the evidence, especially in plan making. We've heard this from Karen, how she's used that data to help shape policy. And this is so important in policy and plan making for planning, really to ensure that we also have agility in pulling data together and how this is reported and analysed. So, and again, I think that's the first point. It's all about the evidence, it's all about the data. So as an upper tier authority, we work positively with all our Nottinghamshire local planning authority partners, supporting them with their statutory local plans. The County Council is also a statutory consultee to the planning process, and we provide detailed comments on all their consultations, particularly the large applications, and we support them with providing information on a whole range of information and on issues that help create our healthy communities in Nottinghamshire. We also have Broxtowe, Nottingham City and Rushcliffe. They're part of the Greater Nottingham Authorities and have published a joint strategic plan which set out strategic policies for housing and employment. So that's a statutory document, and again that will cover a very much larger geography than the individual local planning authority areas. So on that basis, I'd say, and it's my view, that the statutory local plan is probably one of the most important documents a local authority will produce. It sets out the vision, it draws on the data. It should, and that's robust data from it's collected in helping prepare the local plan to prepare sustainable planning policies, and sustainable development is at the heart of the local plan and decision making. And that is, when you look at what sustainable development is all about, it's actually meeting the needs of the present without compromising the ability for the future generations. And as Steve said, we're doing our bit at the moment. We've got to get it right now for our future generations to benefit from, but also our future professionals who are in this business. They've got good foundations to work off, and I think that's a really important point to make. And finding that balance between the economy, social, environmental is really challenging, and there's huge competing interests to find that balance. So when you look at planning and achieving sustainable development in planning terms, the National Planning Policy Framework is the national policy and is the starting point for local plan making and decision making. So as I say, delivering sustainable development is not easy at all. It's very challenging, and in finding that right balance, which is often put under a lot of scrutiny, people will disagree with what that balance looks like. So we often see the three arms of sustainable development as being equal, as shown here, and this is often we see in documents, but often it is not. It's far from that. So, and in reality, there are those competing interests, or there is evidence that demonstrates that more weight should be given to one of the three objectives. So, for example, if there's very high unemployment need, that there may be the economic need might outweigh impacts on social environmental dimensions, so therefore the economic objective will be far greater, so that we always have these competing interests. I appreciate this is a very simplistic way of looking at this, but I've presented this as a challenge because I feel sometimes the social dimension of looking at sustainable development sometimes becomes the afterthought. There are other pressures to get things in first. So the planning system essentially and process ensures that the sustainability dimensions are always carefully considered through that process. So just looking at the social objective from the NPPF, when you drill down on that, it states in terms of creating healthy communities, provision of a range of housing types to meet needs, well designed. It's even got the word beautiful in there, and safe places, accessible services. And this is supported, as we heard earlier, by Chapter 8. And again, that's very much later on in the NPPF. And I think this is why the Spatial Planning and Health Framework is such an important document in helping to start that conversation about healthy communities. It brings that to the forefront. So we're starting to think that early on through the process. So looking forward, we've heard again today that we see the government says that the economy will grow if we build more homes. they're committed to building 1.5 million homes over the next Parliament. And again, that's going to put huge pressure on us. They also say the current planning system is one of the reasons for slow housing growth, and have now put in place a long list of changes as part of the planning reform, which again they say will speed up the decision-making and plan-making process. So there's a whole raft of things going on. But I'm pleased to note that many of these changes will help create healthy places. So the government are giving very strong nods to the fact that healthy places are very important when we look at growth. I'm not going to read all this out, but I've just cribbed this from Katrina Riddell, who's quite an authority on strategic planning. And what I want to illustrate here, these are all the things that have come out of government last year and this year, and still to come in 2025. A huge amount of change that's occurring in the planning system. I've just highlighted a couple of them. So the English Devolution White Paper, the MPPF that I mentioned, and the Planning Infrastructure Bill, where all the planning reform is hanging. So we're looking at some of the things that we see in the change, and I'm just picking out a couple here. There's a new method of calculating housing numbers. There's changes to green belts and grey belt, diversity of stock. There's a huge amount of change. So basically, the government have put this new calculation in there, and we're going to see a whole huge number of houses that are going to be required to be provided in all areas. But when we look at this in the county, this is going to be quite significant. The government are also saying that they want to speed up the local plan process, much more streamlined, so the plans will be adopted a lot quicker. Again, that's a big change to the planning system. We're also seeing through the Devolution White Bill the expectation that the new mayors will prepare spatial development strategies, which will cover a much more strategic area. These will be very much high-level documents and will address economic and infrastructure priorities and also housing distribution. So they will help orchestrate where growth is going to go. So this is just a few diagrams of the East Midlands County Combined Authority. They're already starting to think about in their local economic growth plan areas where that growth could occur. They're looking at clustering. Although this hasn't been subject to wider consultation, it's starting to emerge now. So they're starting to think where that could happen. And again, looking at this at a larger scale can help with the delivery and consideration of creating healthy places. It gives us that opportunity. So as I mentioned, looking at some opportunities, I think local government reorganisation and the MCA will provide that. I think when we look at things at much wider scale, it gives us that opportunity where we can focus our attention at a larger strategic scale. And again, we're starting to pick up that the SDSs will embed healthy placemaking. It's got to really to address the local need as well, and inequalities. It's so important that they embed that. So we'll have that opportunity to influence that going forward. One of the big things that's has been introduced into the new MPPF is a shift from transport planning and modelling. It's now to moving away from predict and provide to a more vision-led approach. So it's setting out actually how we want this area, how we want this growth, how we want people to move around in that area. And it's looking at much more sustainable travel to deliver economic prosperity and to develop healthy communities. And I picked up this diagram, which I thought was quite useful. And this sort of shows the journey of a vision-led approach to transport as part of the MPPF, although we're still waiting for the government to announce more detail on that. And the starting point here, which is really positive, that it says new places designed around people, and then it then creates space used for people. It then means that people can live, work and play in an area. There's going to be less demand. And then it has this really positive cycle of investing in better policies. There'll be more money in looking at alternative modes of travel. So I think that's a very positive thing going forward, this vision-led approach to transport planning, because it's going to get people out of the cars, essentially, and look at all alternative sustainable modes of travel. Some more opportunities which we've heard about. It's opportunity for collaboration and partnership working is key in delivering healthy places. We must recognise that planning is just one component. There's lots of them, but it is very complex and there are interrelated determinants. And I think what we're learning as planning authorities is how public health deliver. So we've heard the word system, and they're quite familiar with a system approach in delivering things, especially with partners. You can't look at these determinants in isolation. It's a system approach. And again, I think there's a lot of learning that we can pick up as planners in helping that and working with our colleagues to do that. We've also heard today how we have a very strong understanding of those determinants that make a healthy place. We've got lots of evidence, we've got lots of information about that. So it's about how we continue learning from that, from the good practice we've heard from Bassett Law. So how can that be developed further and also expanded to other authorities as well, and how we can monitor the outputs and learn, develop and repeat this. It's really important. I put artificial intelligence in there because it is with us. We've also heard how there are many different layers of information, different factors coming in here, and you do wonder how artificial intelligence may help us with that understanding, analysing and those different layers of evidence through helping create healthy places. And then just some challenges, really. We've heard about the growth agenda. We have to be careful that delivering housing quickly just to meet the statistics of housing numbers doesn't forget the importance and needs of placemaking. And I think that is a real risk that we have to be careful of. There's a challenge of seeking good infrastructure to support healthy places, especially in the areas where there is so much need, because there are often viability issues. So lots of the things that we see are needed to create healthy places, developers may turn around and say, well, I can't provide that because I can't afford it. It doesn't make my scheme viable. And that's a real issue and a real challenge as well. And I think the very places that need to improve to become healthy are areas where the planning system just can't intervene. They're existing areas. They're areas that are built decades ago, which may be inefficient or not have good accessibility to them, and the planning system can only do so much. So we tend to look forward, and again that poses the question, how do we change our existing areas so we only look at future placemaking essentially. So again, that's something that we can perhaps think about going forward. And again, we keep talking about healthy places is complex, and it is, so we have to really acknowledge that. And I've used the word wicked problem in there because these are real challenging problems. Nothing's easy, and it's very difficult to find that balance. And that balance will always be challenged and tested in the planning system. So a developer might say, well, I need this because, and that might trump, some really good healthy placemaking. And again, how do we monitor healthy places as well? So just some concluding remarks here. I've just got some photos of some really good practice that's is taken place in Nottinghamshire. There's lots more. So at the top left, we've got Fair and Pastures. This is a development that's been designed by architects from the Poundsbury development in Dorset. They set out on a really good vision, what they want to achieve here. So very high quality design, really good accessibility, really good, a very, very good example. We've got the work that's going on in Mansfield about the sustainable urban drainage scheme. We talk about climate change and resilience, which is really important, but that brings nature into the town. It brings helping to reduce flooding. We know that nature helps with health as well. And in Nottinghamshire, we have lots of healthy places to go to. We've got, for example, we've got Attenborough Nature Reserve there. We've got Thoresbury Country Park, which is associated with a housing development scheme that the developer did. A really, really good, positive country park that people can go and enjoy as part of their lifestyle. We're also seeing now developments where there's very, very reduced car dependency. We've got the Trent Basin, and then we've got this new bridge going across the Trent, which is for cycling and walking, again, just to create that connectivity. So my conclusions here is really making sure that we raise awareness between the links in planning and health, which is really important. It is very complex. We have to acknowledge that. and they are so interrelated. So it is a really, really big challenge doing that, creating very good, healthy places. But there's some very, very good examples in Nottinghamshire. And again, this is just a snapshot. So I'd just like to thank you for inviting me, and I'll hand back to Stuart.
Great, David, thank you, and spot on time. I really welcome you talking about those communities where the planning system, there aren't new housing developments and Section 106 can't have an effect. We tend to talk about retrofitting communities and using particularly green infrastructure to do that. I think what you raised about the government's growth agenda, it's very much a race to increase gross domestic product without really thinking about reducing inequality. And I think our combined work is around how we can make sure that those areas of Nottinghamshire and Derbyshire where that greatest inequality is, how we can try and bring them on that journey as well, so that we reduce that inequality gap that there is. So I think as someone that's looking after a planning department at a county, to be thinking about those communities and retrofitting is really a great vision. So thank you very much for that. We've had a lot of presentations, some brilliant presentations. So thank you for everybody on doing that. I think before we go on to asking you for your reflections and what help you need, we'll just have a comfort break. So I think we've got time to build in until 11:10. If you want to, I think you can boil a kettle, make a cup of tea and nip to the loo in 8 minutes. So there's a challenge for people. Hopefully that everybody can do that. And then we'll come back and we'll do some breakout groups, and we'll get to the real important bit about how we take this work forward. Great. Thank you, everyone.
I'll just check.
Yeah, Rhiannon, I'll just do a quick intro and then we can go into the breakout groups. That would be brilliant. So
yep, that's
great. So thanks everyone for coming back. Those people who put their cameras on, I can see you back. I'm trusting that everybody else is still there. A few people have left to go to other meetings, and there's some comments in the chat around that. Also, Gemma has posted a link to an event coming up around changes in the planning policy, which looks really interesting. So thanks, Gemma, for doing that. So I've also posted into the chat what the 2 questions are that we'd like you to consider. So you're going to have about 20 minutes in the rooms. I'm hoping that my colleagues or people who know me and know I'm going to pick on them will facilitate, just take some notes in the rooms. And then if we have time, we can just do some feedback on there. So just a heads up. Or if there isn't anyone that jumps forward and volunteers, then if someone could volunteer to do that in the room, then we'll get some feedback from a few rooms at the end. So the questions are, what are your reflections and what you have heard? And what support do you need to utilise the framework into your work? I think that can be broader because we do have colleagues here who might not necessarily be planners. So it's about how we can support you to introduce movement and physical activity and health into the work that you do. So if you can consider them, and we'll come back together at about 11:30, that would be great. Thanks, Rhiannon. I mean, just from our group, before I ask others to contribute, there's a lot of discussion about the liaison with local planning authorities, which local planning authorities are going to adopt this framework and take it forward and deliver it at the local level. And these are perhaps answers that can come out after we've done this feedback from the likes of David and Jenny and others. The website, I think there's some feedback that's really good. But how will we make it a used tool rather than a tick box exercise for some? How do we support development management officers who are the ones at the front of service delivery or under the pressures? Mm-hmm. How do we monitor and evaluate the process to see that this is making an impact. Also around how we build in lived experience into the JSNAs. And there's some tremendous information coming from the Walk Nots work around how communities move around their neighbourhoods that a colleague who's on this call, Sarah, has been gathering. How do we feed that into that system so that it becomes a bottom-up kind of process rather than just a top-down? In terms of that need, there was something around training of development managers, but others. We are developing an active design training kind of module or set of modules for the workforce. Could we do that together? And could we perhaps jointly fund some extra capacity into the active partnership area, the two counties, the two cities, with EMCA, with public health, and looking at that future? So that's worth looking at. And there is that piece of work around how we engage with EMCA on this agenda. And we're hoping that the conference that I'll talk about at the end will be an opportunity to bring the mayor in or the new director of place to introduce this really, really exciting work that is going from community engagement through the system, developing policy and taking it forward, and how that place shaping role can be done together. So some big things from our group. If we don't have any volunteers to feedback from other groups, if anyone wants to raise their hand, otherwise I'm going to pick on people. Oh, Charlotte, you weren't one I was going to pick on, so thank you very much.
Well, my group picked on me, so I didn't have much of a choice.
No.
We had a really interesting discussion. Our group was made up of lots of different stakeholders. So we had Natural England, the ICB, LPAs. So it was quite a nice mixed bag. I think in terms of reflection and questions coming out of it, Roz from Natural England said they welcome the framework and it feels that it integrates very well with their green spaces framework. So good green infrastructure is likely to support good health. So that's a nice thing to look at there. Maggie from the ICB said if we could understand each other's probably shared and core goals more, then it would result in a much more joined up approach. So collaboration is key there. And she'd also like it if we could develop a simple narrative to take away for her to present at meetings. She feels like she'd be able to get the word out better. Dominic from Mansfield said that he was reflecting most on what David actually said, that the highest health inequalities are in existing developments, and those existing developments have been there for years, and that's just how they are. And he wants to be looking at how we can actually fix those areas and communities that have been established, rather than not creating a greater inequality gap and stop them from falling behind. And how can funds be used to level those inequalities rather than create communities that are falling farther behind? Karen said that it's been challenging for those over at Bassett Law, and she needed to be creative, discuss some urban extensions and how they were trying to indirectly bring benefits to the whole community, including those already established. And then we discussed other policies such as the hot food takeaway and things like that, how we can sort of prevent further inequality in established areas rather than concentrating on just new developments. Rosalind brought up a good question though and asked if anyone's got any ideas that they could get back to her. She discussed the Green in 15 and how this can actually be achieved retrospectively. Difficult to know where to start unless there's regeneration programs, and potentially looking to reinstate water courses. So if anybody has any ideas, then Rosalind would love to hear from you. We move swiftly over to implementation. Maggie said that she's going to promote the SPHF and RHIA to primary care networks that are bidding for new GPs and things like that to get the word out and to use the framework for that. Karen asked them logistical questions really. Who's supposed to assess the HIA when it comes in? Would it be officers at the LPA or would it be NCC public health officers? And then just generally, I think the consensus was like an education workshop with the officers at the LPA. What do they want to see on it? What are they looking for? What can they go back and negotiate, if that makes sense? So just some overall education of how to actually apply it in practice. And then Dominic discussed that Mansfield is going to go over back to internal partners and see how they can make it work, because they've got different stakeholders that could play a pivotal role in the implementation within there. I hope I've covered everything, group. If I haven't, lovely. Please feel free to speak up.
Thanks.
Great. Thanks, Charlotte. That was for being voluntold, which is a new word that I look forward to seeing in the dictionary. Thank you very much. That was really succinct. And I guess it was similar to our group. I think it's really, really great that David's message about retrofitting those communities of greatest inequality, how we do that. There has been some work, Derbyshire Wildlife Trust have done some work in Derby City around getting the community to help develop green links between two of their parks that are in the most deprived areas, and how you engage the community and creating a bit more connection with nature. So there are a few examples around, but how do we take that to the next stage and disseminate that information, and we fast track that kind of work and make it important. So that's great, and that training for DM staff, absolutely. If we can again fast track that active design principles and build this framework into that training, I think we have the opportunity to roll it out free to any organisation that wants it, and also think about a slightly wider system within those organisations as well. So you involve people who are involved in green space, play provision, maybe housing associations who have large estates of property and doing that. So there's lots of opportunities around that. Please, if Stephen's going to go next, but if anyone else can feedback from their group, just put your hand up. That would be really helpful. So, Stephen.
Yeah, I'll keep this brief. Useful conversations between planning and health colleagues. Gedling endorsed the usefulness of the framework in providing evidence and tools. Eliza from Newark and Sherwood commented on the recognition nowadays of the onus on developers to do other things, such as build out rates, build out forms, the challenge of planning reform that is coming in to potentially try to reduce the level of obligations on developers. I think that is coming through now, so we've got to make sure that this isn't seen as any burden. It's simply clearly good planning. And Sam from Derbyshire Adult Social Care talked about the diversion onto other priorities in the recent years post-COVID. So they've not been able to perhaps pick this up as fast as Nottinghamshire, but useful conversations. I simply added that we were looking in planning terms here to try to ensure that the requirements on rapid health impact assessment could be validated by the county here to support each district going forward, that we wanted to actually make more bespoke responses to applications and look to support other mechanisms such as active travel and green space. And I paid tribute to my Thoresby Vale behind me as a picture of where a developer has put in active routes and pathways and opened up a country park halfway through the development, and it's proving a great asset. So thank you.
Great, thank you, Stephen. Quickly going on to David.
Yeah, thanks, Stuart. Yeah, again, really good conversations from the group. started off by saying it's going to be a really useful piece of work in helping to form local plan reviews. That's from Mansfield. We had a brief conversation around accessibility as a key issue when planning for health. It's not just about availability of the health assets like green spaces, and fortunately we had a rights away officer in the groups and agreed that, you know, we need to achieve expectations that are in the plans, and the point is that providing a footpath is insufficient if it's not to require to the standards. So again, that makes it inaccessible. From Essex, Amber was saying that, you know, we need to think about resourcing and ensuring that they are completed you know, we have good quality RHIAs, and recognise that these are going to be really useful for strategic allocations, and also understand you know, how they will influence development. And then Gedling, you know, really keen to implement the policy that Bassett Law have done and have a similar approach, and very much agree that we should be encouraging this for all major developments. But monitoring is going to be key in all this. Also concerned with the balancing need for housing, which we mentioned earlier. You know, there's a pressure to deliver housing, you know, and the pressures sometimes, you know, can we refuse applications on design quality when there is such a pressure to you know, build the numbers of housing. We also had a conversation about what's changed in this version, and again, this is like a review, so we had a conversation about the journey we've been on with this one, and I think the question was, what learning have we gathered from the implementation of the earlier version? So has there got any data we can learn from that? And I think just sort of going forward about resourcing and support, I think it was suggested that perhaps in another workshop that you may hold is perhaps having feedback on the impact assessments that have been completed, or some really good examples. And then we were sort of having a conversation about how it's important to engage public health in the process of the HIAs, particularly that they hold lots of rich data, and that data will be invaluable in helping to shape that. So again, it's just sort of working with public health in the completion of these. But overall, it was really positively received, and yeah, some really good conversations. Thanks.
Thank you.
Right. Thanks, David. Yeah, that feedback, evaluation, monitoring, really important, because unless we do that, we won't learn. And if we don't learn, we can't improve, can we? So that's really helpful. So I'll go to the other group. So my colleague from Active Partners Trust, Sarah, who's leads the Walk Nots work and gets to walk around and take photographs of Bluebell Meadows, as you can see there. Sarah, I guess you've got some feedback from your group.
I have. It's a hard job, but very fulfilling. So we had a good group with colleagues from Public Health, Planners and Natural England. Basically, everyone really enjoyed the session this morning, going from particularly the high level to the actual practicality. Really enjoyed Karen bringing everything to life in terms of what she's doing in Bassett Law, and thinking about, as Dom had said, how do we look at what's already there, and how do we bring health into kind of like looking at existing housing, and how we can make that kind of like more accessible, more healthy. We also discussed how to bring external partners into the conversation, and we had quite a lot of conversation about how do we engage more with planners on an ongoing basis. Planners also very keen to be able to bring the health impact assessment into design coding, looking at their matrix and thinking about the indicators and aligning those. We had a bit of discussion about 20-minute neighbourhoods or more, so go from 5-minute neighbourhoods up to 30-minute neighbourhoods. So we were discussing pros and cons of that. So going forward is really how can conversations be progressed out of this. Really interested in examples of good practice, of where it's being used, and how often will those good examples be shared. That was one of the main things. And then people can also see lots of ripples coming out of this work already, Jenny.
It is, yeah.
Great. Thank you very much, Sarah. I'm just going to say a few words, and then I think I'm handing over to Stephen to do the kind of closing remarks. And is that right, Stephen, or is that a shock to you?
It's not a shock. Am I?
Okay.
I'll happy to just sum up very quickly, though.
Yeah. So just this picks up one or two of the points that Sarah just mentioned about getting information out on good practice. So you'll see this sign behind me that says Active Environment Network. So those that don't know, we have this network across Nottinghamshire and Derbyshire, which is for the workforce anyone who is involved in planning, developing, building, operating, or marketing spaces and places where people are active. So that's a lot of focus on the outdoors, but as much as it's parks, it's also streets. It's about marketplaces, footpaths, community centres. It covers the wide breadth. And every couple of months we do a workshop which is themed. So we've previously done one on health and planning. I mentioned the next one is on the importance of children's play. I will, if people are happy to receive information on our network, then that's great. If you don't want to receive that, then let me know. We have got a conference on the 15th of October, which is face-to-face at Chesterfield Football Club, which the theme is creating a movement from your doorstep. So it will pick up a lot of the information from today. We're hoping to have Police and Crime Commissioner colleagues involved, EMCA involved, health, Sustrans, etc. So that's an opportunity to come along, understand where other organisations are, what their thinking is, but also dissemination of good practice that's been happening. But also we want the people that come to that to develop the future programme for the network. What do people want to hear about? What training needs there are for people? So please engage in that. It's very much your network that we just provide the capacity and the facilitation to do that. So I'm going to hand over to Stephen and say thank you very much. From my perspective, the speakers were absolutely brilliant at keeping on time, and I've really enjoyed the feedback from everybody. So I'm going to go away with a bit of a buzz today and think about what the next stage is from Active Partners Trust point of view on that. So over to Stephen.
Great, thank you. Thank you, Stuart. Yeah, I'd just like to conclude by thanking all our presenters today, and Stuart in particular for emceeing it and providing that sort of neutral chairing. So I'm sure we've all learned a lot. There is so much more we can do, both as planning and health colleagues, to improve the lives of people in our areas. It's about partnership working, and certainly the partnership working we've developed in Nottinghamshire is great. And we've heard about the challenges going forward, challenges of planning reform, but the challenge of health and health inequality in particular. So there's a challenge about how we reach and improve the lives of those communities who may not receive a lot of development, but also need to have opportunities, better quality environments to live in and to flourish in. So I think there's lots of challenges there for everybody. So I just like to say I think that's given us a lot of food for thought. And I think in Nottinghamshire we can look to knowing that we're not alone on that journey together, and reaching out for the appropriate support, both as planners and as health colleagues, to work across the professional. I don't think there is a professional divide. I think, as Gemma highlighted, planning and health have always been partners together, and they'll go on doing that. So I'd like to thank you for attending, and Stuart in particular, for chairing, and we look forward to sharing in future for conferences together. No, that particular one in the autumn. So thank you for your time, and for all the colleagues who've helped to put this session on this morning. So many thanks, and hope to see you again soon.